This is the Fertility Friday podcast, episode number 38. Welcome to the 38th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been enjoying the show, I would love it if you would take a moment and leave a review and a rating on iTunes. It would help the show move up in rankings, and it also helps more people to find the show. And I would like to say a special thank you to all of the listeners who have left reviews already. I recently discovered how to read the reviews from all of the different countries, and I was absolutely thrilled and excited to hear from so many of you. And also, if you enjoyed today's episode, please stop by the show notes page and leave a comment. So you'll find all the episodes at fertilityfriday.com/podcast. And I've also recently created the Fertility Friday Facebook group. So if you go to fertilityfriday.com/community, you'll be redirected to the group. You'll make a request, which will go through me, and I'll approve you. And the group is still in the initial phases, and with time, my hope is that we'll build a thriving and supportive community of like-minded women that will help each other in understanding and gaining confidence using the fertility awareness method. And for today's show, I'm so happy to welcome Lisa Leger to the show. Lisa is a Justice holistic reproductive health practitioner, and she's actually one of the very first HRHPs who was trained in the very first wave, and she's been working in the field since 1988. And she has an extensive background in women's reproductive health and fertility, and she also works as a natural health consultant in British Columbia. So in today's show, we'll be talking about the profound impact that the fertility awareness method can have throughout all the different phases of a woman's life. And we'll also be talking about the history of justice and all kinds of different topics. So I'm really excited. So without further ado, welcome to the show, Lisa.
Hi, Lisa. Nice name you got there.
I know. You too. So I'd love to start. I gave you a short introduction, but I'd love to start with your story. How did you discover Justice, and how did you first fall into this work that you've been doing for basically your whole career?
Well, I tell you, I was always interested in wellness. I did my BA in psychology at the University of Waterloo, and I actually managed to get a psych degree without taking abnormal psychology. I wasn't interested in what can go wrong with the human mind. I always wanted to study what could go right. And so I studied a lot about meditation and spirituality and altered states of consciousness, and geared all of my research and studies around positive experiences of the mind, body, and soul. And I was very captivated by that triangle, the notion of, body, mind, spirit being in alignment or in balance with each other. And it's used in a lot of religious symbolism around the world. So even while I was doing my degree in psychology at Waterloo, I kept sneaking off campus to go take courses on herbs and massage and therapeutic touch and things like that. And then when I graduated, of course, like everybody else at Waterloo, I went to Toronto to look for a job. And I ended up working for these holistically oriented medical doctors in a clinic on St. Clair Avenue West. There was Carolyn Dean, Carolyn DeMarco, Tris Trethart, and a few other medical doctors who were under OHIP. They were general practitioners under the medical system, but they were very, very interested in natural medicine approaches. So they were advising their patients to eat healthy food, filter their water, maybe take some supplements or herbal medicines now and then. And I really felt like this was the best place for me to be. I walked in there and there was, vegetarian cooking classes on the bulletin board, and Dr. Carolyn Dean was teaching me how to make homeopathic remedies my first day. So I was extremely happy. And then after a while of managing that office and being involved in the reception area there was this woman who kept taking people into her office, and she'd be in there for like a whole hour and sometimes longer, sometimes couples and sometimes women by themselves. And I noticed that she was the wife of one of the doctors. It was Tris Trethart's doctor, Geraldine Mattis, who we all know and love as the founder of the Justice method. So back then, Geraldine was actually teaching the Creighton model, which is, as some of your listeners probably know, a fertility awareness method that kind of came out of the early history of those methods, kind of an adaptation on a Billings approach. So one day I said to Geraldine, "What are you doing in that office over there anyway?" And she said to me, "Well, I'm teaching women how to chart their cycles so that they can understand when they're ovulating and when they're fertile and when they're infertile in their cycles. And then they can use that information for birth control or for pregnancy planning." And I went, "Hello, I want to be your client right now." I pulled out my little booklet from my purse and I showed her where I was circling day one of my periods. I had always kept track of that. And so I was in my late 20s. I had used hormonal birth control pills. I had used IUDs. I had sort of grappled with birth control throughout my life at that point, and I always felt there should be a way of just kind of knowing when the fertile days were. So I was absolutely primed and ready for this information. So Geraldine taught me to chart, and she taught me the Creighton model, which she was teaching at the time. And they use, if any of your listeners chart, and we use the purple and violet stickers for the fertile days. Back then, the Creighton model, they actually used little stickers that had pictures of babies on them, Lisa. Yes,
Wow.
like fertile days had these little white stickers with pictures of babies on them.
That's a serious
I guess
reminder.
that was meant to be a deterrent. So Geraldine taught me to chart, and her version of the story is that this absolutely blew my mind. I realized every woman should know this. I want to teach everybody how to practice fertility awareness. And in Geraldine's version of the story, I pestered her mercilessly until she got her training course together so that I could become a teacher like her.
Hmm.
My version of the story, of course, is that I waited patiently for her to get her training course together. And then she collected 5 women, and we were the original first class of Justice teachers. We met every Saturday and I think one weekday a month or something like that for our classroom time. And we literally sat in a classroom together. This was before the days of the internet. There was no Skyping going on. We sat together and had discussions and listened to lectures. And then we did a lot of reading on our own. We had a great big binder of stuff to read and a bunch of textbooks that we studied from. And in that course, the thing that made it unique and what really sort of has made Justice unique all along is that Geraldine incorporated the holistic approach to health right from the very beginning. So she taught us how to teach women how to chart, but she taught us much more than that. And if any of your listeners are actually studying the Justice method with us or know an HRHP, you'll know that our knowledge extends beyond just the charting to sexual and reproductive health. So we were being exposed to what the naturopaths were learning on gynecological health. And literally we were using what was called the gray binder, which came out of John Bastyr University in Seattle at the time, which was thought to be the Harvard of naturopathic colleges. And the gray binder was sort of the natural protocols, most of them put together by a quite well thought of naturopathic doctor called Tori Hudson. And she has developed a lot of really great naturopathic protocols for gynecological health, for natural approaches to women's health. So that was part of our studies way back in the very, very first class of Justice. And of course, over the years, as you know, it has developed further as all of our knowledge has deepened. The course that's offered now for an HRHP is so much deeper in knowledge because, of course, Geraldine has deepened her knowledge and understanding of the material, and so has science. Science has developed a better grasp of endocrinology. We didn't exactly know back then how the organs talk to each other. We didn't know what the glial cells were doing in the brain and how they were conducting neurotransmitters and all this sort of stuff that we know these days. So we had a really, really good foundation in how to teach charting as well as how to convey these natural health protocols for our clients. And that's kind of how my career began, working with Geraldine in that clinic setting. A lot of the clients that we saw were patients of those holistically oriented doctors, because, of course, as you can imagine, the first thing that those doctors wanted to do when the patients came in all sick and dealing with depression and period problems and food allergies and sensitivities and candida yeast overgrowth is those doctors wanted to get those patients off the pill
Yeah.
as soon as possible. And that's because they knew that that was a tremendous impact on their health status. And if they could remove that one great big huge heavy straw from that poor little camel's back of the person's overall general health, then a lot of things would fall away. A lot of things would start to get better. So when these natural health oriented medical doctors wanted to get their patients off the pill, what did they have to offer in terms of birth control as an alternative? They had us teaching fertility awareness, and it really worked quite well. So we were able to help those clients learn to use this alternative method of birth control. And we were also able to work with those holistic doctors to coordinate the therapies that those patients would try. So that went on for a number of years and did a lot of birth control counseling, reached out to a lot of the women's health communities in Toronto and took part in the Toronto Women's Health Network, which was mostly public health nurses. And then over the years, what started to happen is new students came in, the course was offered again. And because I was working with these holistic doctors, I ended up being the person who got the tough cases. So I got the infertility clients, and I got the polycystic ovaries and the fibrocystic breasts and the perimenopausal women and those sorts of clients. Because my colleagues could handle the birth control clients on their own, I tended to get the more complicated ones. And that went on for quite some years, probably from 89-ish to, let's see, 96-ish when I moved to Vancouver Island. And that's a whole new chapter in my life, which I could tell you about if you are interested.
Well, sure. I wanted to make a comment I thought was really interesting. Well, the whole story, but I thought was really interesting that you happen to find yourself working amongst doctors who, when women present with those particular issues related to their menstrual health and their overall health, that their first approach was wanting to get women off the pill. Whereas I've had a number of guests on the show and actually had a medical doctor on the show who practices the NAPRO technology, which was really interesting. But obviously in typical medical settings, the first approach is to put women on the pill as soon as they have a presenting menstrual issue.
Yeah. And don't you think that's rather a short-sighted solution? Because really, it's, as we know, conventional medicine tends to deal with symptom management rather than solving the underlying problem.
Mm-hmm.
So if you have irregular periods, the solution isn't put you on the pill so that you have a bleed once a month, because that's, as we know, of course, not a real bleed. But in somebody's eyes, I guess that seems to be a solution. Don't even get me started on that subject, because we could slag the pill all night, Lisa.
Yeah. Well, why don't you talk a little bit about how your practice changed when you moved to BC?
Sure. So what happened then is I came out to Vancouver Island, and of course I brought my practice with me, but I wasn't working with holistically oriented medical doctors anymore. I ended up in a job at a pharmacy because I had managed supplement stores in Toronto and worked with holistic doctors and naturopathic doctors. I kind of knew what those doctors would recommend. And having worked with the supplements for quite some time, I was able to get a job in a pharmacy setting where they wanted somebody on the staff who knew about the vitamins and the herbs. So I went and worked in a pharmacy setting, and now all of a sudden, my customers are not the converted. They are
Hmm.
not the patients of holistic doctors anymore. These are people who are on prescription drugs. And that was a big culture shock for me because my whole career up until that point had been with people who were like minded, who were interested in nutrition, who thought it was a normal thing to take supplements and herbal medicines. So when I came to the island and began working in a pharmacy setting, I noticed that people weren't willing to take herbs. Their first question was, well, what do they taste like? And
Hmm.
I said, well, they taste like herbs. So, and then also it was a different crowd because the people that go shop at the supplement store or the health food store are usually not as sickly as the people that are in the pharmacy setting. So I was seeing people who were really not well, really not doing well at all. And over the years, now that's been about, let's see, 18-ish years that I've been in a pharmacy setting. I've been the natural health consultant in a pharmacy setting. So I've been still the herb and vitamin lady, but in a venue where people really aren't hip to that sort of thing. So not the converted anymore.
Hmm.
Mind you, I have been able to convert some of them because they'll talk to me. They'll be willing to talk to somebody in a pharmacy setting more so than walking in to see a naturopath or walking even into a health food store to talk to the staff in there. So it's been, I feel a little bit as though I've been kind of um, behind enemy lines a bit.
Yeah.
Um, working in a setting that normally wouldn't have somebody like me on staff. And in a way, I feel as though that's been really quite a civic duty because I'm touching the lives of people who would not otherwise have even been exposed to the notions that I'm bringing to them.
Hmm.
So that's been quite interesting.
Did you find that to be challenging? I mean, did you find it such in
Oh, are you kidding? Of course, Lisa. I'm
but
biting my tongue every day.
did you find yourself thinking, I wish I was working in a, more of an easy setting where
I
people
mean,
were already coming in
well,
looking
I gotta
for
admit,
what you had to
sure.
offer?
Yeah, that would cross my mind now and then, of course. Yeah. But I really do think that it's better for me to be in this setting because I am talking to people who would not otherwise have had even the remotest idea that perhaps what they were eating could have an impact on their health and so on. So I'm happy in a pharmacy setting. It is a challenge. It's a challenge in many ways. There's a certain amount of cognitive dissonance going on there. I am biting my tongue daily. I'm not kidding you. But I really do think it's kind of like I say, a civic duty. It's something that I can contribute to my community. And I do live in a small town. And so I have actually made an impact on
Hmm.
many people's lives. And so I do think that that's a great thing. And now that we have the internet, of course, I can reach out and talk to my colleagues like you
Hmm.
via Skype and online. So I don't feel too isolated.
Well, that's good to hear.
Hmm.
Well, one of the questions I wanted to ask you was, since you've been doing this work and you've been a fertility awareness educator for so many years, I'm not counting the years in my head accurately at this moment. I was kind of wondering, what changes have you observed or noticed? Have you noticed changes in the women's charts that you see and the health overall? Different, was it different when you used to work with women in the late 80s versus the women that you work with now?
In general, Lisa, I'm sorry to say, but people are a lot sicker these days. So many people have digestive troubles. Everybody's been told they've got IBS.
Mm.
People are limping around with undiagnosed low thyroid function and so on and so forth. So, overall, I think people have more health challenges now than they used to. Specifically with women, I find that most women have been on hormones, whatever age range you want to talk about. Hormonal birth control is introduced at a younger age in the past, say 10, 15, 20 years than it was back in my day in the late 80s. women didn't go on the pill until maybe they were 18-ish, maybe 16 if they were really quite young. That would have been considered. Now what we're seeing is young women, even, 13, 14, 15-year-olds being put on the pill to regulate their cycles. And hello, they shouldn't be having regular cycles. They're in puberty still. So a normal part of puberty is having irregular cycles. And again, as we mentioned earlier, the pill doesn't regulate your cycles. It just gives you a fake bleed once a month. And that's not the same thing as having a healthy hormone feedback loop, of course, as you well know.
Well, I remember one of the things that Geraldine used to talk about is that when she was working with women back when she first started, their charts were tended to be more straightforward for the most part, because the majority of those women hadn't either been on the hormonal contraceptives, or they hadn't at least been on it for a long time, or like you said, hadn't been put on it early. And so from what you're saying with women being put on the hormonal contraceptives a lot earlier, that has an impact on cycle health overall.
Well, yeah, of course it does. So what we're seeing is the side effects. Some of the health challenges that I alluded to would be digestive issues. We know the pill can have an effect on the microbiome, as it's called, in the intestine. We also know the pill can deplete certain nutrients from the body, folic acid and other B vitamins, as well as magnesium. So then you get nutrient depletions. And then going hand in hand with nutrient depletions, especially B vitamins, you can start to have low mood, end up diagnosed with depression, and end up being put on an antidepressant drug. So all of these things compound in a woman's life, so she can end up with digestive troubles, mood issues, and hormone imbalances, including thyroid. And all of these things may well have entered into her life because she was placed on hormonal birth control at a young age. So yeah, women are not as well as they were even when I started my career, not to mention when Geraldine started her career, which was again a few decades before me. So yeah, the pill certainly has taken its toll on women's health. Of course, socially, it has helped women make tremendous gains economically and socially, and we're not slagging it for that reason. We're just pointing out, of course, that there is a price to pay in terms of health. And like most prescription drugs, side effects are the price you pay.
Mm-hmm. Well, and from your years of working with women, so if a woman's listening and she's been charting her cycles for a while and she notices that her cycles aren't perfect and she's having some challenges, maybe she's having some fertility challenges, maybe you could talk a little bit about the impact that the work that you do has had on women throughout the years, especially with regards to having a holistic approach and addressing the root causes of some of these issues that you've seen.
Thank you. Yeah, that's a great question. As I said, the first thing that the holistically oriented medical doctors wanted to do when their patients presented was get them off of those hormonal drugs. From there, what the doctors wanted to do was try to rebuild the gut to resolve those digestive troubles, correct the nutrient depletion by the use of supplements, and restore the endocrine system, basically. So we're talking about letting the hormone feedback loop come back, letting the organs of the endocrine system talk to each other again, permitting the proper functioning of the endocrine system to be restored. And these can bounce back on their own in a healthy body with the proper support. Sometimes the clients needed quite a bit of support, quite a bit of intervention. Sometimes just by removing some of those straws from the camel's back, the woman's health would be regained just on its own, spontaneously, but sometimes some intervention was required. And I've observed that through my career, even if my clients aren't actually charting or seeing me for fertility related problems. I'm talking about just clients who come into the pharmacy setting. Even by helping support some of these factors, we can see tremendous improvement in health. So, for example, a lot of times what we'll see is people come into the pharmacy and say, "What kind of remedy have you got for this symptom or that symptom?" And often I find myself saying to them, "Well, why don't we try and remove the thing that's causing this symptom or that symptom?" So instead of adding more pills to your program for this or that symptom, let's see if maybe we can take away the thing that's given you grief in the first place. It could be a food irritant. It could be a pathogen of some sort, a yeast or virus or bacteria or some sort of infection, perhaps. You could be lacking a certain vitamin, or you could be underproducing a certain hormone or something like that. But often what I find is people want to add to
Mm-hmm.
instead of thinking about what they could maybe take away from their burden, and so that they wouldn't have that health problem related to whatever that thing is. Interesting way to think about it, though, isn't it? And I've actually talked people out of buying supplements.
Well,
Yeah.
it's the opposite of the way that our culture teaches us to think about things. If you have an issue, it's, go to the store and pick up something to get rid of it right away,
Hmm.
temporarily, generally speaking, as opposed to actually looking into the problem and finding out what it could be causing it, getting rid of that, and then you could have a more permanent solution. For example, in as you said, food allergen could be causing whatever symptom, excess mucus production, or something like that.
Excellent.
And
So
then,
that's really insightful of you, Lisa, because this medical mentality of symptom management, a pill for every ill, as they say, can really get us into trouble too. And we've got to remember that each of those pills does come with a side effect.
mhm.
So even the natural stuff, one of the side effects is it costs you money,
Yeah,
and you've got to remember to swallow them every day. So, the more, as much as we can do by avoiding the irritant, removing the trigger, and then allowing the body to do the work of healing and correcting its problems, the better off we are. And sometimes, of course, we do need to intervene. And I would always intervene with a natural medicine before I turned to a prescription drug.
so naturally, with the approach that you have, the more holistic approach, you are at odds with traditional medicine. And as a Justice HRHP for all these years, what has your experience been like working with other medical professions? Have you found that the work that you're doing is accepted and that it is valued, or have you found that you had to actually kind of fight for that recognition that what you're doing is valid and important and effective?
I would say that both of those things have happened over the years. I've found myself in situations where a nurse has said, "Oh, but you don't have a nursing degree." And I've also been in situations where my pharmacist colleagues, for example, have deferred to me and said, "Oh, go ask Lisa about that. She'll be able to explain that to you." So, it happens both ways. And I really think that it's not so much a function of the profession as the personality who's wearing the profession. I have worked very nicely and companionably with medical doctors, public health nurses, pharmacists, and so forth. And if anyone out there is listening who's in an alternative type profession, I'll just give you a little piece of advice. My strategy has always been act like it's normal. Act like it's normal for you to be at the table. Act like it's normal for you to have something to say. And when you call a doctor or a nurse or a chiropractor or anybody else that you have to interact with, and you're the herbalist or the massage therapist or whatever, and there's some sort of totem pole there that somebody might be aware of, you just act like you've got a perfect reason for being right there talking about that patient along with those other practitioners. We're starting to realize more and more all the time that nobody can be the sole caretaker of any patient, and that it takes a team of practitioners with all sorts of modalities to truly take care of our patients. And my strategy has always been, I just pick up the phone and say, "Hi, Dr. So-and-so, it's Lisa Leger. I'm teaching your patient so-and-so how to chart. I've observed this of their chart." Or I'll write that doctor a letter and say, "This has been my observations. Wonder if you'd like to do this test or that test, maybe check their thyroid function out." Act like it's perfectly normal to be doing that. And the reason that I have had this strategy all along is because I'm hoping it's going to come true someday. And I think if we use this as our strategy, act like it's already true now, I think we're going to kind of hasten that transformation. Mm-hmm. We're going to make that happen, that the team approach becomes more acceptable, more assumed, and it's not going to be never approach it apologetically, like, "Oh, I'm sorry, I don't want to, use up your time or anything," but never do that. Always approach it as though you've got the perfect right to be there and having something to say.
Well, ultimately, patients want results, and women want to feel better. They want to be healthy. Some women want, obviously, to restore their fertility so that they can achieve pregnancy. Other women just want to know that they are healthy in every way, their menstrual cycles. So I think that that's an excellent strategy. I really like that. And I think that at the end of the day, it's what women want and need, because like you said, we do need that team approach, because everyone has something different to add to the puzzle. It's not that you can only have one or the other. You kind of need everybody's different expertise depending on what your health issues are.
You're right, Lisa. I like what you said about the results, because in my observation, after all these years on the floor, in the store, in the field, consumers don't care if it's a drug or an over-the-counter pill or a herb. They just want results, like you say. And if a herb will give them results, they're perfectly happy to take a herb.
Yeah.
And, if they're not getting results, they don't care if it's a prescription or an over-the-counter thing. They don't want to continue with it if they're not getting results. So that's very, very true. I think, some of our clients are devoted to the natural life, and they have opinions, and they have allegiances to nutrition and natural approaches to healing and certain modalities and all those sorts of things. But for the most part, people really just want results, and they're happy to get them wherever they can get them. Mm-hmm. A good example of this is menopause. Could we talk about that for a little while?
Yes, I was going to ask you about that next.
Okay. So, of course, charting is useful for women of all ages. We talk about using the menstrual cycle chart as a method for natural birth control, as a way of strategizing, avoiding, or achieving pregnancy. In my practice, I've looked at many charts sort of as a diagnostic tool to try and figure out what might be going on hormonally in a woman's cycle. And, classic examples of that would be abnormal bleeding, irregular cycles, PMS type problems, and issues related to the perimenopause. So what we find, of course, is women with these types of problems, they want results, as we said, and they're happy to get them wherever they can, and they are willing to try things. So, and that's pretty much true all throughout the lifespan. Most women find that the chart is useful to help them understand what's going on with their cycles. And they do feel more empowered by that to make decisions about what they're going to do from one week to the next, depending on where they are in their cycle. And that can be extremely helpful for obviously avoiding pregnancy, but also planning when you're going to throw a dinner party. Let's face it, you'd rather do it when you're feeling all twinkly and energetic around ovulation than throwing your dinner party when you know you're going to be, on your heavy flow day and feeling a little bit tired or wanting to just curl up in the bathtub with a novel. So the usefulness of the chart is, of course, it does apply to the whole lifespan. But dealing with the perimenopausal years is kind of a unique thing. When the Women's Health Initiative study came out, this is probably going back around 15 years ago now, and everybody chucked out their hormone replacement therapy. You might have remembered that whole story. Premarin and Prempro, which was what was used in the study, but hormone replacement therapy in general really fell out of favor when the media reported on the Women's Health Initiative study showing that there was more harm than benefit from the Prempro arm of the study. More harm in terms of blood clot, risk of cardiovascular disease, and we've since confirmed even more higher risk of certain cancers like ovarian and breast cancers. So at that time, of course, and I and my colleagues were all saying, hallelujah, thank you, finally, this is making the media and people are being made aware of what we've known all along, that those risks and side effects were very, very real. So finally, it became common knowledge, and it affected the prescribing behavior of doctors, and it affected women patients' willingness to take hormonal birth control, of course, too. So what happened then is basically doctors took their hands off the steering wheel and said, you're on your own, go figure out what to do about your perimenopausal symptoms on your own. And so women were flocking to the health food stores and the pharmacies and the holistic reproductive health practitioners for some sort of an alternative to hormone replacement therapy. And it was absolutely fantastic because now we had this great big patient pool of women who were eager candidates for our care. And they were quite certain, quite adamant that they did not want to take hormone replacement therapy like their mothers and aunties had done. At that stage in the game, some of their mothers and aunties were starting to have health problems that could have been related to their past hormone use. And a lot of our, current clients were not willing to go down that route. So teaching them how to chart was a very, very useful thing, and teaching them how to manage their symptoms by actually getting healthier worked out really well too for many of us. And we were able to look at some of the alternative ways of dealing with these things rather than, as we talked about, that whole symptom management approach. Instead, we were looking at women as individuals rather than treating them all the same with a cookie cutter approach. Oh, you're of a certain age, here's your prescription for this stuff. Instead, we were looking at women as individuals and saying, well, gee, you're having night sweats, you're having hot flushes. Are you drinking a lot of red wine in the evening? Are you under quite a bit of stress? What do you eat? Do you drink enough water? Have you got meaning and purpose in your life? Do you take any exercise? And all these other factors that could be playing a role in their health. So, hallelujah, women patients were starting to be treated the way that we felt they should have been treated all along. And we were there. We were poised to take advantage of that change in the zeitgeist, really, that happened at that time, and has really been sustained quite since then. To this day, women come into the pharmacy and say, I'm not willing to take hormone replacement therapy. What have you got for me to help me manage my symptoms? And having become a certain age myself, I've got to tell you, there is certainly a lot that can be done to make the perimenopausal years more comfortable. Would
Mm-hmm.
you like some specifics?
Absolutely. This is an area that I haven't addressed on the podcast, and I think that a lot of my listeners are in their, perimenopausal years, and I'm in my 30s, so I don't really, menopause is going to happen someday, but at my age, you don't really think about it, and I think that it's amazing to really hear about the implications of using fertility awareness and being aware of your menstrual cycle changes all throughout your life. So
Hmm.
please do.
Okay. Well, first I'll tell you a little story about myself. So I had fairly normal, regular, and quite robust cycles all throughout my childbearing years. I did have some bit of PMS now and then, a couple of heavy clotty periods now and then, nothing too severe and always quite regular. But then as I was getting into, I think I was in my 40s, there was a little bit more stress in my life. There was a little bit more drinking of alcohol going on in my life, and perhaps maybe not quite as healthy of a diet as I had had maybe in my 20s and 30s. So sure enough, around that time, I started to get some PMS symptoms, lumpy, painful breasts, irritability, and some night sweats. And I realized, these are things that I could actually do something about based on my knowledge. I could actually apply some of my knowledge to my own situation. And so I went ahead and did some research and decided what I should do. I'd like to tell you what I did, and it requires a little bit of backstory here. Hopefully, your listeners will be able to follow the what might be going on hormonally situation here. When we're talking about women in their late 30s, 40s, and definitely early 50s, we're talking about a huge range of ages in which these things can start to happen. But what starts to happen is that the ovaries begin to fatigue. And the ovaries have been popping out an egg every month for quite some time, or at least every cycle, as we know. And they start to fatigue. They start to get that hormone message coming down from the brain to tell them to ovulate again. And they say, really? Again? You want me to do this? Oh, okay, all right. And they try to crank out another egg. And in the process of doing that, as we know, estrogen gets produced during the ovulation phase of the cycle. So when women's cycles begin to become further apart, what's actually happening is that ovulation is getting delayed and delayed and delayed. And then that pushes the whole thing back. So during that whole time that ovulation is being pushed back, quite a lot of estrogen is being produced. And so the classic scenario, what's going on hormonally in the perimenopausal situation, as well as the most common types of PMS, at least, is that estrogen levels are excessive and progesterone levels are not in the correct ratio as the estrogen. So we get into a situation of estrogen excess. And I would love for you to be able to interview Jerry Lynn Pryor on this someday, Lisa. She's done a lot of writing and research. She's an endocrinologist at UBC who wrote a book called Estrogen Storm Season.
Mm-hmm.
And she talks about excess estrogen from a medical perspective, but very, very enlightening perspective as well. And the whole kind of scenario of what's going on when there's estrogen dominance. So I figured out through my own research and knowledge that I was in that situation. I was having way too much estrogen and not the right amount of progesterone in ratio to that. So Dr. Pryor's solution is to boost the progesterone to correct the ratio, and then you feel better. But what I knew from my naturopathic doctors and the work that I had done with herbal medicine is that a better approach would be to try and reduce the estrogen levels. And so I got this stuff from the shelf, which is called DIM, DIM. It stands for diindole methane. Diindole methane is an extract from sprouted broccoli seeds, which have an indole component to it. Do you know what indoles are? Indoles are talked about in the context of flax seeds being protective against breast cancer.
Mm-hmm. Yeah, I've also heard of the indole 3-carbinol in broccoli.
Yes, thank you. That's another example. So these indoles that are isolated in these products that are called DIM basically help the liver process estrogens and allow them to be converted into the safer forms. So I realized that my liver was probably struggling a bit and that my estrogen levels were getting a little out of hand. This would have been in my late 40s. So I grabbed a bottle of that stuff and I actually took it very half-heartedly. I probably took 2 tablets before bed most nights of the week, maybe 4 or 5 nights out of the week for maybe a month and a half. And you know, that absolutely corrected everything.
Wow.
I had no more night sweats. I had no more lumpy, painful breasts. I had no more PMS. That all went away for about 6, 7 years. I'm not kidding you. All it did was help my liver process those circulating estrogens and allow them to get out of my system. So I actually bought myself 6, 7 years of not being perimenopausal with a bottle and a half of DIM. Now, I'm not saying that's going to work for everybody, but it worked tremendously for me. And it's probably because I basically was pretty healthy and had a decent diet for the most part. And my liver was probably in decent shape too, so it was able to respond to it fairly well. Now that I'm about to turn 55, I do notice that there's the occasional night sweat starting to creep back in. But I am still having regular cycles, and I'm still identifying ovulation by mucus observations. And I may not be ovulating every single cycle, but I think I still am ovulating some of the time. And it's really been very fascinating to chart my cycles over these years. I think I probably started charting when I was around 27 or 8 years old, and I'm about to turn 55 and I'm still charting. I've charted my whole adult life. I did have a pregnancy and breastfed for a while in there, and I did not chart during that time because I had no cycles. But for the rest of my life, yes, I have charted. And I've been able to observe the impact of my diet and lifestyle on my cycles. It's there in black and white in my very own handwriting, and I can see what I've been eating, what I've been drinking, what I've been up to, if I've been, overdoing it. It shows. It shows. And when I get back onto a health kick and start some healthy, clean living, that shows too. And of course, I've seen that in my clients' charts over the years as well. Want to hear one of my favorite stories?
Oh, absolutely.
This is early in my career. I was still in Toronto. It was probably the early 90s. I had a client. She came to me. She wanted to learn how to chart because she had been single for quite some time. And even though she was she was around 50 years old, she was still having cycles, and she was starting a new romance in her life. And she didn't want to get pregnant. She wanted to know if she was ovulating or not. So I taught her to chart, and things were going great. And then one time she was in for a follow-up, and she said, "Oh, this breast pain. My doctors diagnosed me as having fibrocystic breast disease. And I've got these painful lumpy breasts in my premenstrual phase of my cycle. It's getting worse." So I said to her, "Okay, well, I know that the best way to treat that is to remove caffeine from the diet." So I said to her, "Why don't you try reducing your caffeine and actually charting when you drink coffee? Chart your use of caffeine." So she did. She had been charting for quite some time. She was quite comfortable with charting. It was a normal routine for her to do that. So she just started making a note on her chart when she had coffee. And of course, she charted her breast pain too. Do you know, like within a cycle or two, she could figure out exactly how many coffees she could get away with before her breast pain would come back. So she got rid of all her fibrocystic breast pain. And then, of course, she started creeping back in on the coffee again. And whoa, then it would start to come back. So she would ease off on her coffee drinking. She got it down so that she knew she could have a coffee every 2 or 3 days and she could get away with that. But in the premenstrual phase of her cycle, she had to really curtail it even more and maybe only have coffee once or twice a week. She was perfectly happy with this. She was glad to be still able to enjoy coffee, just a little bit less often than she had in the past, and be free of her fibrocystic breast symptoms. So there's a really great example of, well, here's two great examples of 50-somethings who are still charting and still finding their chart extremely useful.
Hmm. I think it's so in line with what you talked about initially about how instead of adding a drug, adding a remedy, that you want to find what is causing it and then kind of take away. And I think that it's so nice how it lined up with that. The fact that, because as you know, bioidentical hormone replacement therapy is all the rage. And I'm sure it has its place, but it's very interesting to consider that in your case, instead of adding in the progesterone to try to force some sort of balance that's
Mm-hmm.
obviously in your case wasn't necessary, you actually looked at the cause and tried to instead reduce your estrogen levels, which was extremely effective for you. So I find, yeah, I love those examples. And I think it's important for the listeners to hear the different implications. I think for someone who maybe hasn't charted for very long or has never charted, I think it wouldn't occur to you how many things that you could actually see. And it's part of it is just the act of actually recording what's happening and being able to reflect on the changes based on how much alcohol you drink one week or how much coffee you drink or how much cake you eat or whatever, and to see how these things actually do affect us in all these different ways.
That's a great observation. And you know, whenever you talk about people making positive changes in their lives, whether it's, you know, coping with an addiction, they talk about this in AA, for example, all the time. Um, Changing a habit or, you know, taking on a new practice like meditation, for example. What is the first step? Self-observation, right?
Yeah.
Self-observation is the first step in any change you make, whether it's quitting smoking or whatever. So the chart is a perfect modality of self-observation. You're observing your symptoms, you're observing your changes, you are making note of things that go on, and you're starting to see the patterns. I've had clients over the years who've observed, gee, every day that I ovulate, I get diarrhea that day. That's weird. Well, I might as well chart it. And that becomes a useful symptom for her.
Mm-hmm.
Oh, there I go. I had my loose bowel movement today. That must mean that there's more evidence for me to confirm and improve my confidence that sure enough, I'm identifying ovulation correctly. So, whatever it is for you, the listener, if you observe some sort of pattern, some sort of continuity, some sort of thing that seems to be related to something in your charts, in your life, in in your behaviors, in your moods, in your sex drive, make a note of those things on your chart. They may become a very, very useful information. And I think the chart teaches us discipline, obviously, but it also teaches us to trust our own judgments. And this is something, you know, we could go off on a tangent about, but, you know, as women, we are sometimes not encouraged to trust our own judgments, that we need some sort of evidence or corroboration. The discipline of charting enhances our ability to trust our own judgments, I think. And that's kind of like a pleasant side effect for a change, isn't it?
Mm-hmm. Yeah, it's very reinforcing because it allows you to test your intuition in a way. Because if you think, I wonder if my sugar consumption is affecting my cycle, you can test it and you have a kind of a real-time measure of how these things affect you. So you have your intuition and you can actually kind of do a little scientific experiment on yourself.
Mm,
And it gives you
mm.
feedback, and so it's really powerful. And so I have a few questions to wrap up the interview, but before I ask them, I just wanted to ask you if there's anything that you wanted to share with the audience or anything else that came to mind, just given the discussion that we've had today.
Well, I did want to direct your listeners to the Justice website. It's justice.ca. The charting app is there. You can actually chart the Justice Way online, which is really tremendous because not only is it a charting app, but it's also a teaching tool. You can actually learn quite a lot about charting by working with that app at the Justice site. And as you know from your own studies in the Holistic Reproductive Health Practitioner program, we've got a tremendous resource there for people that are wanting to join us, become our colleagues. As I said at the beginning, Justice teaches you not just to be a charting teacher, but to be a sexual and reproductive health practitioner. And so the knowledge and skills that you gain from working with us at Justice go far beyond charting to actual health care. And reproductive health is an area where practitioners are needed. So if anyone who's listening is interested in joining us, please go check out that site, and we'll hopefully be talking to you some more online.
Mm-hmm. I'll definitely link to the Justice page in the show notes. So a few final questions to wrap up. What would you say is maybe one of the most important things that a woman should know about her fertility?
Oh, thank you. So I wrote a blog for the Society for Menstrual Cycle Research blog site Recycling about mucus. And the thesis of that blog was, this is my key message, and thank you for giving me an opportunity to spread the word. The most important thing to know is that the mucus is related to fertility. I think if there's one thing that public health nurses and sex educators could say to people when they're giving them a lesson on the menstrual cycle, is what that mucus means. So when you wipe and it feels slippery and it feels slick, and you look at the tissue and there's something on the tissue there that you could finger test and look at, that means that it's a fertile day. And if we could just get that one phrase out there to share with the world, I think that would save a whole lot of grief and a whole lot of indecision and wondering if is it a safe day, is it not a safe day, should I use the morning after pill or not, oh my God, I wonder if I got pregnant. Oh, this is one piece of information that I think is so important for us to dispense. So tell all your friends who aren't listening today.
Yes, mucus is fertile. Mucus is fertile. Um,
Mm-hmm.
what is the biggest myth about the fertility awareness method that you would like to see corrected?
Oh, gee, the biggest myth? Oh, well, that's a pretty easy one too. My colleagues and I talk about that all the time. I would say the biggest myth about fertility awareness is that it gets lumped in with the rhythm method. And the rhythm method is absolutely not the same as fertility awareness. There's a lot of our colleagues have explained this on their blogs and on their newsletters. The rhythm method is just basically a math equation calculation based on past cycles, projecting onto future cycles to guesstimate when the fertile phase is, while fertility awareness is a prospective method. It's actually based on observations from day to day, and it's making a judgment about the fertile phase based on observations that are made in real time in the actual moment. So fertility awareness should never, ever be lumped in with the rhythm method.
Mm-hmm. I couldn't have said it better. And then last question of the day, what is the biggest myth about a woman's fertility in general that you would like to see corrected?
The biggest myth about women's fertility is that ovulation is silent or unidentifiable, that ovulation somehow happens in this mysterious world that we can't know about. I think that is a very unfortunate myth, and I don't know how that ever happened, but this notion that women couldn't possibly identify ovulation because it's this thing that happens inside the body and we can't see any evidence of it is obviously not true, because we can see mucus. And 100% of women on Earth have seen mucus when they've wiped. So if they knew what that mucus meant, that meant that they were close to ovulation and they were in their fertile phase of their cycle, then everybody would know what the status of their fertility from one day to the next. So I guess the biggest myth about fertility is that ovulation is some sort of occult event that we can't identify.
Yeah, I love that. Well, Lisa, thank you so much for being here today. It was absolutely my pleasure to spend some time with you and interview you and talk about these topics. And you mentioned the Justice website. Were there any other websites that you wanted to direct the listeners to if they wanted to reach you, or if they wanted to read more about any articles that you've written, or contact you in general?
Best way to contact me is via the Justice website. I am a member of the Association of Fertility Awareness Practitioners, AFAP, and I'm also a member of the Society for Menstrual Cycle Research, SMCR, and both of those agencies have a presence online. Look at Fertility Friday's website and look at our colleagues' websites. Colleen Flowers has an excellent website, Red Tent Sisters. There's lots of great information out there. If you like to listen to Lisa's podcasts, tune in for some of her other guests have been excellent. Her interview with Katie Singer, for example, is really great. And I'm eager to hear more. So it's a great community to be connected to. And I just applaud all my colleagues who are working to educate people about fertility awareness.
Oh, thank you so much. And I'm sure that we'll connect again soon. So thanks again for being so generous with your time tonight.
And thank you for your questions. And I've enjoyed my time with you, Lisa. Talk to you again.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You can always find me on Twitter at Fertile Friday, or you can stop by the blog and leave a comment in the show notes for today's episode, which you'll find at fertilityfriday.com/38. So the number 38. You can also find me on the Fertility Friday Facebook fan page, which you'll find at facebook.com/fertilityfridays with an S. And you can also join me in the Fertility Friday Facebook group, which you'll find at fertilityfriday.com/community. And so all of the links that Lisa and I talked about this evening or day, depending on when you're listening to it, you'll find those on the blog post. And if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. Of course, leave an honest review, and that just helps more people to get a hold of this fantastic information. And that's part of the reason I'm doing what I'm doing, just to get it out there so that women can learn about all this awesome fertility awareness information. And so thanks again. I appreciate you so much for taking the time to listen. And as always, until next time, be well and happy charting.